Legislators tell me the need is growing. They call this proposal targeted policy intervention, saying the impacts could go far beyond just diapers.
When a family lacks access to diapers, it impacts their health and their well-being.
1 in 2 families struggle to afford diapers, up from 1 in 3 families pre-pandemic, according to the Diaper Bank of Connecticut. Across the country, 47% of families with young children struggle to afford diapers, an increase from 34% in 2010.
It is so important that irrespective of whether you are Black, you're white, you're Latino, you're Asian, you're rich or poor, Republican or Democrat, that you have access.
Diapers are more expensive, and organizations like the Diaper Bank no longer have pandemic-era federal funds. That's why they want Medicaid expanded to cover diapers.
We know that diapers are an essential means to ensure diaper hygiene, and they prevent a range of avoidable medical conditions in infants and young children.
Children under a year old represent 40% of all UTI hospitalizations in the U.S. This bill would allow Medicaid to cover diaper purchases for children 3 years old and younger with medically necessary conditions like urinary tract infections and diaper dermatitis.
About half of the parents using childcare have missed almost up to 4 days of work per month because they didn't have an adequate supply. That equates to about a $6,000 amount of lost wages.
Currently, Tennessee, Minnesota, Vermont, and Delaware have similar policies. While there's no exact cost for implementation yet, Gilchrist says in a state budget year, this bill is good fiscal policy, too.
The offset are any number of health conditions the infant and toddler could experience, which would result in them being in the hospital, mental health needs of the mother, and then, as you also heard, not being able to go to work, to either take care of your child who's experiencing those health conditions, or you can't send your child to childcare without diapers.
Representative Gilchrist tells me since this isn't a new concept, she's taken criticisms and ideas from past sessions and thinks this year the bill has broad support. Reporting at the state capitol, Emma Wolforst, Fox 61.